Will quitting typing for a month solve my repetitive strain injury? Hello, I'm Deborah Quilter, and I've written 2 books about repetitive strain injury. So to answer the question, if you have repetitive strain injury and it's painful for you to type, will taking a month off from typing resolve the problem? It might if you are one of the lucky people who is able to get to a doctor who knows how to diagnose repetitive strain injury when it's in stage 1, the very first stage of injury, when the symptoms are very mild and might be overlooked by a doctor who is not well versed in diagnosing RSI. And also, it might resolve if you don't go back to the offending activity, namely typing. But in reality, most people don't realize they're injured until they're in stage 2 or stage 3, when the injury is likely to become chronic. And even if you could reverse repetitive strain injury, if you go back to the offending activity, such as typing, you're going to risk getting re-injured. I would also like to add that using a mouse is even more dangerous than using a keyboard, but that's a story for another video. If you've reached the point where you think that you should be taking off work, it's usually because you're in considerable pain, and that means you're in the latter stage of injury where it's now chronic. In other words, you need to cope with it every day because it doesn't go away. Soft tissue injuries, such as repetitive strain injury, are notoriously hard to heal and very easily re-injured. During their time off, people might think they're healed because they're no longer in acute pain. But when they resume the offending activity, when they go back to work, then the pain can come back within moments. It's not uncommon for people to take several weeks off work only to come back and find that they're in the same pain within moments of using the computer keyboard or mouse. Sometimes people get some rehabilitation and they can go back to work for a while, but because of their injury and because of the way you get re-injured from continuing the offending activity, they can't do the full workload that they could do prior to their injury. They just don't have the endurance. So then people can get into a cycle of injury, rehab, re-injury, injury, time off, go back to work. And I've seen that happen with many people over the years until they finally realize they just can't keep up anymore, or they get fired. When the soft tissues are damaged, they are replaced with scar tissue. And scar tissue is more fragile and more easily injured than normal healthy tissue. And that's why you can get into this cycle of injury, rehab, re-injury. But it can also lead to substitution and compensatory injuries because now you're using your body differently to compensate for the lack of ability in one area. So now, instead of having just one diagnosis, you could have more than one. And this can happen even after you've improved your workplace ergonomics, posture, and pacing. Even when people are in physical therapy, they can have relapses. The tissues just aren't capable of handling the workload that they did prior because they don't have the endurance. And even if you could take some time off from typing and come back to work, consider this. You're going back to the same job and performing the same activity that got you into trouble in the first place. You're using the same workstation, keyboard, and mouse. You're sitting in the same chair. You could have the same poor posture, the same poor technique, and the same lack of frequent regular breaks. And most of all, the very act of bending your elbows and turning your palms down is in and of itself a risk factor for injury because you're twisting the muscles, tendons, and nerves in order to maintain that position. We are meant to be using our arms in what's called the anatomic position, which is what you do when you're walking. Your arms just swing back and forth. They're not meant to be in a pronated palms down position for hours on end. This is one of the primary causes of 3 common forms of repetitive strain injury: carpal tunnel syndrome, cubital tunnel syndrome, and epicondylitis, or tennis elbow. So when people get repetitive strain injury, does it automatically mean that they're going to lose their job? Not necessarily. If you can get the proper accommodation, for instance, using voice dictation instead of so much work on the keyboard, a better chair, a better keyboard, and proper pacing and posture and technique, you might be able to keep your job. But because normal hand use is so critical to almost every job you can think of, it's very difficult to find work that you can do unless you become very entrepreneurial and create a career and workstation where you are in charge. You can take breaks whenever you need them, work at your own pace, and have an ergonomic setup that really serves you. So to answer your question, taking a month off work from typing is a great idea, but I would suggest that you use it to plan another career. Because of all the things that I mentioned before, it's just so easy to get re-injured, and it's so difficult to get normal hand use back. So don't put your hands at risk. Think of something else you can do where you can be in charge of the pacing, the proper ergonomics, and protect your hands so that you can use them for the things that you need to do every day, such as brushing your teeth, washing your hair, buttoning buttons, cooking meals, opening doors, driving, childcare, all of which could be difficult, painful, or impossible if you have severe repetitive strain injury. So many things that we do on a daily basis that we never give a second thought to until it begins to hurt or become impossible to do. The other thing I'd like to say is that the body doesn't respond to your timetable. In other words, I've heard people say, I'm going to take 6 months off and then I'll be fine. The body doesn't work that way. The body heals in its own time, and because of the serious nature of repetitive strain injury, you may never get full carefree use of your hands back. So you need to be careful about how you use them in every instance. Please don't assume that taking a month off of typing will resolve your repetitive strain injury. And in the case of repetitive strain injury, it's so easy to become re-injured, even more seriously than the original injury. And remember, you can't use your other pair of hands to do all the things you need to do on a daily basis. So you need to be careful about how you use your hands in all of these instances. If you have any experiences that you'd like to add, you can drop them in the comments below, but be sure to watch the video that's coming up next or linked below for more great information about repetitive strain injury. And take good care of your hands.